Good afternoon. I wanted to use this opportunity today to share with you how I traveled and paved the transformational highway. Because what I wanted to do in this journey is to change the way healthcare is being delivered in our various settings today. It's been very exciting and challenging for me to do this. But what I wanted to do as I stand before you today is to tell you how we did it, where we went with this, who were our partners in doing this, when did this occur, and most importantly, to emphasize that the paving of this transformational highway is not done. It needs to be done more, and all of you are going to be a part of this as you light the road and plant evergreen trees on this road. Why do we need to do this? And the answer is very, very simple. Our population and our culture is demanding that we change this. That's very apparent to all of us. Many times we do things and we are doing things and we're stuck in the same old way of doing things. Look at the way care is rendered on the nursing unit today in hospitals. I saw this as a healthcare executive and as I was driving the car down the transformational highway. The needle was not moving fast enough for me. It never moves fast enough for me because I'm a futurist. I like to see things or what it's going to be tomorrow. So, and I want to create an environment for tomorrow for my grandboys and for generations to come, because all of us here today and all of us back in your respective healthcare institutions and companies, we must be the drivers of this. We must all collaborate together. As I have mentored students during my career in hospital administration, and as I have lectured in classes at the Medical College of South Carolina and at the George Washington University, and as I have done strategic visioning sessions for clients and retreats for hospitals, one thing is very paramount to all of us, and that is change. However, when they add the word innovation to it and how they implement it, they get kind of scared on that. And so that's what I do now in my career. And I saw this as a need when I was an administrator, chief planning officer, as a patient, and as a caregiver. I go back to my grandboys. I listen very intently to them, and their ages 9 and 7. And this generation, as I listen to how they talk to one another, and listening is very, very important, as we saw yesterday. They're going to usher in a new way of thinking in helping us pave the transformation highway more and more. My mission to you today is to challenge you, because we're going to be the ones that light up that highway as we create new models for us to tell the world about, like we're doing here, as well as tell the government. Because if we're going to change the reimbursement system that we have now in our country and elsewhere, we've got to show proof. We've got to show these models. I want to share with you a quote that I always read to my board members as we started a meeting. And that quotation is from Clara Barton. Clara Barton was the founder of the Red Cross in America. Let me read it to you. I have almost a complete disregard of the way things used to be, and a faith in the possibility of something new. It irritates me to be told how things have always been done. I defy this tyranny. I go for anything that might improve the present. That's me. And that was the journey of me from a child, and why I started this journey down the road. Because that was my defining moment, how we can improve this. Growing up on a farm in eastern North Carolina, I was a curious learner. I grew up on the Outer Banks of North Carolina where the first colonists came over and where the Wright brothers flew the first plane. Recently, I read a book by David McCullough on how the Wright brothers flew the first plane, how many iterations they went through in flying this first plane, the criticism that they did after they launched their project, and how they took it forward to be implemented in what we have today with our airlines. It made me think about the many iterations that I went through as a planner in a hospital with so many iterations of the patient room, could never get it right. We always said, oh, we should have done this. So I had an opportunity to do this all over again in my career. One day, a healthcare executive from a well-known healthcare company came to me and said, Tom, you really have done a lot in your career. You really need to share this with the world out there, to tell them so they can learn from your fruits and your labor. Started thinking about that. Added to that, I was at a critical point in my career where I had to do a strategic plan for the institution where I was a chief planning officer. And this was a strategic visioning plan that I had to guide that hospital in terms of what Mayo has done here and that you have heard from what was going to be not only yesterday, but 10, 20 years down the road. Out of that plan birthed a new hospital. This hospital was in the upstate of South Carolina, population growing. We had to look at this, and as a result, we birthed a new hospital. I couldn't get it wrong. I had to start thinking about, okay, how we're going to do this. Again, the needle was not moving fast enough for me. I did not want to go and do it the same old way, to build the same old platform of a hospital. So we took two things that we focused on, and that was the patient room, because that was the nerve center of the hospital. I talked to everybody I could. I traveled all over the country and the world, looking at new ways of doing things. People inside the healthcare industry, people outside the healthcare industry, of what we were going to do. So as a result, we did many iterations of the patient room, and as a result, we built black box rooms and many iterations of that. Entered into a relationship with Clemson University that had a well-renowned, not football team, as you all know, but also a well-known architectural department who helped me. We did not start with the architecture, we started with human factors. What were we going to do? How were the caregivers going to interact with that room? As a result, we were able, after many iterations, and we were able to put this room in operation in that new hospital. We also, as a result of that, did more extensive research with that patient room, because after all this work, we did not get it right yet, but we wanted to make sure the next step we took, we got it right. As a result, we took a lot of work from and a lot of data from our past. We also took information from what we were doing with our own experiences in the hospital environment. So as a result, we birthed Patient Room 2020. I told you we talked with a lot of industry partners. As a result, this is centered around a product that we used in that hospital called Corian finishes. We did that because at that particular time we were very concerned about infection. Corian is a product that can deter infections. We also looked at many, many other things, and we feel like we got the first cousins of this room right. Now, as we did this room, DuPont invited us to do this patient room in their design studio in New York City. What an opportunity. It was an opportunity of a lifetime for me in order, with all my experience with doing patient rooms, to really birth this patient room in a setting where the world could see it. As a result, in doing this, we had over 30 manufacturers and 30 companies, again, collaborating with us to bring products to this, which was very future in nature and very operational too. As we did this, we looked at factors of cost, quality, safety, satisfaction, experiences. We also looked at processes, people, culture, and futurability and technology of the room. Now I want to tell you the outcomes of this, because it's not enough to just say, oh, have this room here. But as I said, we opened the doors with collaborations with numerous partners. We entertained many visits to this design studio with hospitals, with companies, to begin really thinking about what could be. Getting back to Clara Barton, we didn't want to do same old thing, but challenge healthcare that this is a new experience, a new built environment to be put into place in the patient care unit. So with that, we talked to many people. We opened up the doors to how this room really emphasized quality in terms of the area research that we did. We also looked at the modular approach to do this, constructability of this room. It could be done off campus and moved to a location, and open up the doors for modularity in healthcare. We emphasized and strengthened that design thinking model where people would come and look at this and look at new ways of doing things. New opportunities arose for us. We did not concentrate only on the patient room, because one physician one day called me and said, Tom, okay, the patient room, you're spending a little bit more time on that. You need to look at the physician office of the future. We did, and we have some of those in operation today. And we also collaborated with a company in Norway in looking at wearables. So where I'm going with this is that this whole room generated a continuity of thinking, continuity of care. And that my last visit with a guest from a computer company here in the United States, he said, I want to see the product that you made. And so I met him here at the room, and he walked all around the room. He said, Tom, you know what you've done here? You really created the home of the future. This is where care is going to be generated in the home of the future. And we thought about that, and he was exactly right. And I can see the continuity here on our panel today, where this thread is completely woven together. I just want to conclude with two quotes that I want to leave with you. We are all architects to change the world of health. That's Leland Kaiser, well-known futurist in 1980. So we all are architects. And one quote from the MIT Media Lab, which we worked with also, stands with me today. The best way to predict the future is to invent it. So I challenge you to pave your road ahead of you. It's an exciting journey. Learn from me, and I'm not finished with my work with Clemson University. We're also looking at the operating room of the future. Just concluded that study last week, and many people, many companies use the Patient Room 2020 as a model for futuristic thinking. Thank you.
Thank you, Tom.